So give us a little more color, Brian, as to what you guys are looking at in New Jersey hospitals and how severe the shortages are getting of critical supplies.
Sure. Thank you, Sarah. It's nice to have you focus on this. So, here in New Jersey, we are in the middle of this. This morning at our preparedness meeting, we have about 300 patients in our hospitals throughout the region who are either COVID positive or we are awaiting tests. And as I said to you guys a couple of weeks ago on one of your sister shows, things are still the same. We need access to quick testing and results reporting. We need protective equipment to keep our team members safe. And we need ventilators moving forward. Those are the things we're focused on, and there's just a lot of activity. All that being said, our teams are there. They're doing an amazing job, not just in our hospitals, but on the telephones and telehealth. And, we're there for our communities. But our cases are growing over the last 2 days by about 25% each day, and that's a very scary number.
We read so many dispatches on social media, Twitter and Facebook, from emergency room doctors and all sorts of doctors that are really on the front lines of this. And it's disheartening at times. What do you do to keep the morale, to keep the healthcare workers coming to work and help them feel safe during this unprecedented crisis?
Healthcare workers are the most amazing human beings in the world. Every day they get up and do incredible things. And this is really not different than that. And we're used to taking care of sick people, and we're used to taking care of people that are this sick with pneumonias and other things. What we're not used to is having to worry about the supplies that we're getting to make sure that our team members are protected. And as I look at our situation right now, we are putting our team members' safety first and foremost in everything we do. But it's getting harder every day as our activity levels are increasing. And I think that that's what our team members are most concerned about.
It's alarming. And as I understand it, you're also the chair of the American Hospital Association. So I wanted to ask you about the condition of hospitals broadly speaking here. And I'm talking financially. If people are putting off elective surgeries, that's a major profit center. They're now grappling with a once-in-a-generation crisis and scrambling to get the equipment in place for that. Are we going to have hospitals on the brink of, I don't want to use the bankruptcy term, but needing some real relief? And is relief in the stimulus bill as far as you can tell?
Yes, we are absolutely going to need some relief because as you properly characterized, we have really decanted a lot of the services from our organizations over the last couple of weeks to try to create the capacity that we need for the emerging numbers that we're seeing. That has impacted revenue in a pretty dramatic way. Plus, we've added a lot of expense associated with this. On average, each patient who is either under observation or in our hospitals goes through about 20 sets of PPE per day per patient. And when you combine those factors, that really does put hospitals in a significant, a difficult position financially. The bill that is before the Senate right now has over $100 billion of aid to hospitals, and we are stressing to all our elected officials, vote on it, get it done. We want the president to sign it, and we need to get those monies flowing.
Love to get your take on ventilators. We just had a conversation with the CEO of Medtronic, one of the bigger manufacturers of ventilators, and he seemed to more or less admit that despite their best efforts, it's going to be quite a while until hospitals like the ones you run can have enough of them conceivably. Are you short on ventilators? Are you going to need more? Are you concerned at all about your ability to actually secure them if you do need them?
So every day as part of our emergency preparedness process, we get a report on the use of ventilators, and we are using a lot of them right now. Almost over half of our stockpile ventilators are today in use. And when I go back to the numbers that I mentioned earlier about the increasing levels of activity, it becomes a concern because about 25 to 30% of the patients that end up hospitalized end up in our ICUs, and a significant portion of them are on ventilators. It is an absolutely critical item. That's why we really encourage the federal government to release the stockpiles that they have. We're asking ambulatory surgery centers and other types of healthcare facilities that do anesthesia as part of their service to bring those to our hospitals and health systems. And we're going to have to really look at this carefully throughout the country as this disease progresses, because it is pocketed in certain regions. And there are going to have to be efforts at the federal level to make sure that as one area may not have as many cases, the other areas that do are able to get those resources. And then open up what's in the military. You know, the military, whether you're in the Guard or active military, the military has a lot of these technologies. And this is a time where we're going to have to figure out a way to distribute those.